Bismillahirrahmanirrahim. Hello and welcome back, friends. Welcome back to another video lecture by microbiologist. I hope all of you are well and fine. Today I am going to explain another lecture that is related to the hormone test and it is about the progesterone blood test. Okay. Now if you guys remember, we already talked different hormones like we have talked FSH, LH, TSH, T4, T3, prolactin, luteinizing hormone. Okay, so if you miss these steps of the hormone test, so I will recommend go back to my channel and watch this video lecture. You will in my YouTube channel you will find the playlist of the hormone test. So if when you click it, so then you will find all the lecture of the hormone test. So today I am going to explain progesterone test in detail. So my name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. Let's start the video. Dear viewers, first of all let's see that what is actually progesterone. Progesterone is actually the type of the hormone that is mostly produced from the adrenal gland. It is actually the hormone of the female, okay, or we can say this type of the hormone are mostly secreted from the female. In the female, mostly it is secreted from the ovaries, placenta, adrenal gland and testes, and in male it is a small amount will be produced from the testes. Okay. Now let's see the main function of this hormone. So the main function of this hormone that it can prepare the uterus for the pregnancy. It can also prepare the breast or enlarge the breast for the milk production. It can also regulate the menstrual cycle process as well. Now this is the procedure. This is a short introduction related to the progesterone test. Now let's see that what are the diagnostic purpose of this test, why we perform this test. So mostly the doctor recommend this test for different purposes. So this test is performed to check the infertility issue in the female. This test is also used to detect the menstrual cycle problems. This test is also diagnose the anovulation and oligo-ovulation. What is anovulation? Anovulation means the absence of the ovulation, especially in the menstrual cycle. And oligo-ovulation means the irregular or infrequent ovulation. We call that oligo-ovulations. Okay. So if you want to check anovulation or oligo-ovulation, you must perform this progesterone test. This test is also used to check out the pregnancy issues or to check healthy pregnancy. This test is also used to potential spontaneous abortion. What does it mean? It means that due to this test we can also find out the risk of the abortion. Moreover, this test is also used to check the level of the progesterone. Either it get high and it get low. So because we better know that when the progesterone level get high and if it get low, so there will be the problems. This test is also used to check the treatment efficacy which we are providing. So dear viewers, this is a very short, this is all about the diagnostic purpose. Now let's see that the procedure of the test, that how to perform this test. First of all, you have to take the blood in the gel tube or in the red tube, or you can also take the blood into the green tube as well. Now you will centrifuge the blood and will get the serum or plasma. Then you will run this test on advanced fully automated machine like we have Bendre, Meglomi, Selectra, Architect, Cobas, etc. These are the fully automated machine. You can also perform this test on semi-automated machine that based on FIA, means fluorescence amino assay, in which we have Digrade, Lofia, we have fine care machine as well. Now let's see that what are the main causes due to which the progesterone level get high into the blood. So it is due to the adrenal hyperplasia and neoplasmas. And adrenal hyperplasia, when the adrenal gland get high. Neoplasma is a type of the cancer of the adrenal gland. Chorioneptheloma of the ovaries. Now what does it mean? It means the carcinoma of the ovaries or cancer in the ovaries. Next we have corpus luteum cyst. Now what is corpus luteum cyst? It means the cyst into the ovaries. Next we have molar pregnancy. Now what is molar pregnancy? Dear viewers, instead of healthy placenta formation in molar pregnancy, what will happen? There will be a cluster sacs formation into the placenta. Okay. Next we have the ovarian neoplasma, which is the abnormal growth of the ovaries, or we can say it is a type of the cancers of the ovaries. Next we have precocious puberty. It means early puberty, or we can say puberty especially in the childhood, or especially at the age of 9 or 10 or 7, at the age of 7 if there is a puberty. Okay. In case of the pregnancy, so the level of the progesterone will be high. Now let's see the main causes of the low progesterone in the body. So it is due to the adrenogenital syndrome. What does it mean? It means that it is actually the genetic disorder of the adrenal gland. Next we have the amenorrhea. Amenorrhea means absence of the menstrual cycle. It is due to the annular menstrual cycle. Annular menstrual cycle, it means that when the egg is not produced during menstrual cycle, we call it annular menstruation. Next we have fetal death. When the baby get die into the mother abdomen, into the fetus, so we call that into the uterus, so we call it fetus death. In menopause, in menstrual disorder, ovarian failure, pre-eclampsia, Steinens-Leventiel syndrome, or we call that polycystic ovary syndrome. It is actually the irregular menstrual cycle, or we can say irregular period cycles, or sometimes the periods will be absent. So this is called polycystic ovary syndrome. So dear viewers, due to this way, due to this condition, what will happen? The progesterone level get low into the body. Now let's see the normal range of this progesterone level. Remember guys, especially as this hormones is mostly secreted into the female, so when there is the follicular phase, remember in female, if there is a follicular phase, so the hormone level will be low, or it will be less than 0.7 nanogram per ml. During ovulation, the hormone level will be 0.06 to 4.2 nanogram per ml. And in luteal phase, the hormone level should be 4.1 to 14.6 nanogram per ml. So this is all about the progesterone blood test. I hope you guys get idea about this. If still you have any kind of question, you can write your question into comment. I will try my best to give you answer as soon as possible. If you like this video, make sure to hit the like button, share this video, and also subscribe the channel to get more interesting videos like that. Thank you so much.